I'm Charlie Venti. I'm board chair of ACNJ, and on behalf of the ACNJ Board of Trustees, I want to welcome all of you to the release of Trenton Kids Count 2023. And I just have to say, what a great crowd we have today. Really appreciate the involvement and the interest of the entire greater Trenton community. This is the third Kids Count report that ACNJ has published for the city of Trenton, although actually our first report was 20 years ago. Trenton Kids Count 2023 was published with the input and assistance of the Trenton Kids Count Committee in both identifying data indicators and potential sources and contributing stories and programs, and these are the activities that are really behind the data. Several entities also provided the photos that are included in the report. Trenton Kids Count 2023, that's a little hard for me to keep saying, would not be possible without the generous support of the Burke Foundation, the Princeton Area Community Foundation, and the Smith Family Foundation, which is also hosting our event today. I'd like to recognize and thank Atia Weiss, Jeff Vega, and Catherine Nunnally, and all of you and everyone else that you'll hear from this morning. We have a presentation by Kids Count Coordinator Elena Siddiqui, followed by a terrific panel that will be moderated by a committed and long-term community activist, Eleanor Horn. The agenda for today is at your table. I didn't see any of our other board members today. I'm wondering if Winifred Scott Jenkins has arrived. But if any other board members arrive, we'll say hello. As most of you know, the Kids Count data reports provide a snapshot of child well-being and are intended to inform members of the public about the challenges and successes that New Jersey counties and particular communities face in ensuring the health, welfare, and safety of all of our children. Like other ACNJ Kids Count reports, the Trenton Kids Count 2023 includes the latest statistics along with the 5-year data trends in the following areas: demographics, family economic security, child health, child protection, child care, education, and teens. So why does ACNJ publish the Kids Count data? We gather and publish the data because policymakers, including elected officials and government agencies, use the data to make informed decisions. Service providers use the data to improve their response to emerging child-related issues in their communities and in their cities. Grant writers use the data to write proposals and solicit support for programs that help children and families. We publish the data so that concerned residents, like all of you here today, become better and more informed advocates using the data to identify and address problems facing children in your own community. The most recent Trenton Kids Count report was published in 2019. Following the release, more in-depth community conversations were held to talk about the data and what might be done to improve outcomes for children and youth in the city of Trenton. Similar community conversations will be held this year. The dates and focus of each of these conversations are on your tables or on your seat. They're in your book. I'm corrected. You can register for one or all of these conversations before you leave today or on the ACNJ website. We hope you will attend at least one of these meetings and join ACNJ, the Trenton Kids Count Committee, and the funders in efforts to improve outcomes for children living in Trenton. Together, we can all make a difference for kids because kids count. And Sure. Would the Trenton Kids Count Committee please stand, be recognized? And on behalf of our board and Mary Coogan, our president and CEO, we want to thank the committee for all of the hard work that you've done to bring us to today and going forward as we engage with our community partners. Now I'm going to ask Atia Weiss to come up and take us to the next stage.
Welcome, everyone. Thank you so much for joining us today for the release of Trenton Kids Count 2023. My name is Atia Weiss, and I am the Executive Director of the Burke Foundation. We are so grateful to the Advocates for Children of New Jersey for producing the Kids Count report. Oh, sorry. We're so grateful to ACNJ for helping produce this wonderful report. We'd also like to thank members of the Trenton Kids Count Committee, the Smith Family Foundation, the Princeton Area Community Foundation for offering their input, their knowledge, and their stories to bring the Trenton Kids Count to life. You have done an amazing job bringing this to life. A lot has happened since we teamed up with ACNJ and Catherine at the Smith Family Foundation to produce Kids Count 2019. That was the first Kids Count for Trenton in over 20 years. And since 2019, as you all know, we've gone through a global pandemic, and we've seen incredible activism since George Floyd's murder to raise awareness of racial and economic injustice. And as a result, we are just beginning to see a profound shift in nonprofits and philanthropy to fund and invest in community-led and community-driven change. As you'll hear today, the data in this report is powerful. Trenton Kids Count 2023 reports many promising trends, including fewer low birth weight baby births, a decrease in the rate of children living in extreme poverty, and a decrease in the infant mortality rate. But the report also shows there's much work to be done. Since 2016, fewer Trenton women are receiving prenatal care in their first trimester. Preterm births, which contribute to significant health concerns for babies and moms, increased to 10.8% in 2020. When looking at data by race, we see that Black mothers fared even worse, with a 2020 preterm birth of almost 16%. Trenton has made incredible strides, but our work is not over yet. And at the Burke Foundation, we're proud to work with our partners in Trenton and throughout New Jersey to advance systems-level solutions that begin in the first 1,000 days of life and promote those nurturing relationships between children and their caregivers. To that end, we have invested $2 million over the last 5 years in initiatives serving the Trenton community. And we're committed to listening to Black and Brown families to understand their needs in navigating the healthcare systems and the injustices that they face, and to invest in their solutions. We believe in data and research to advance equity, to promote early childhood development, and to improve the health of babies, families, and communities. And we also believe in the power of people. People such as the Amar Community Doulas at Children's Home Society of New Jersey, who guide families through the complexities of the healthcare system and advocate on behalf of birthing people and their families. People such as nurse home visitors of Family Connects Mercer County, who connect families to community-based resources and work with babies and mothers in the comfort of their own homes. And people like Dr. Nicole McGrath Barnes, founder of Kinder Smiles, provides a free dental clinic and oral health education to children, pregnant women, new mothers, and families one smile at a time. So yes, there's much work to be done, but the passion and commitment of our partners leaves me awestruck, inspired, and hopeful for a better future. So thank you all very much for having us here at the Burke Foundation. We've been honored to partner with all of you to produce the 2023 Trenton Kids Count. And I'm happy to introduce Alina, who's going to come and speak about the data in the report. Thank you all very much.
Good morning, everyone. My name is Alina Siddiqui. I'm the Kids Count Coordinator at ACNJ, and I'll be talking about the Trenton Kids Count 2023 report. We'd like to thank our funders, the Annie E. Casey Foundation that supports our overall Kids Count reports, the Burke Foundation, the Princeton Area Community Foundation, and the Smith and the Smith Family Foundation, who all made the Trenton Kids Count 2023 report possible. We'd also like to thank the members of the Trenton Kids Count Committee, as well, who are part of different programs and agencies throughout Trenton. They have also been gracious enough to provide pictures and stories of the work they are doing to benefit the children of Trenton. A reminder, Kids Count data are from publicly available sources, and we source information from federal, state, and local entities. Most are available on public-facing websites, however, some are obtained through a special request, and we list all of our data sources at the end of each section of the report. So, as we all know, the COVID-19 pandemic has upended so many things over the last few years, and data are among them. Most official sources of data do have some lag time, and this is because data takes time to collect, to verify, and to assess. Unfortunately, this means we still do not have a complete picture of the true impact of the pandemic on child well-being. Data lag aside, there are some limitations to the data that are available that were specifically caused by the pandemic. Several indicators that many are used to seeing in our Kids Count data reports are notably absent this year. This includes school meals and chronic absenteeism. School meals and chronic absenteeism data for 2020 are difficult to compare to prior data because of the ways instruction changed during the pandemic and state shutdown. Virtual instruction meant that school meals were distributed in unconventional ways, and even after in-person school resumed, school meals were still distributed differently than in the past due to expanded federal waivers. On another note, you may notice that for some tables in the book, the year goes from 2019, skips 2020, and then goes to 2021. This data was from the American Community Survey, and the Census Bureau decided not to release 2020 one-year estimates due to data quality concerns. Now moving on to the data. So starting with demographics, in 2021, the total population of Trenton was 90,458, and the child population was 22,323, making up 27% of Trenton's total population. Trenton is also very diverse, and here's a comparison of two 5-year estimates as we're looking at 2011 to 2015 and 2016 to 2020 data. The majority of the child population in Trenton identifies as Hispanic at 47%, Black or African American at 46%, followed by 13% identifying as other, 6% as white, non-Hispanic, and 1% as Asian. The American Community Survey is self-reported, so it is how people choose to identify themselves. On the American Community Survey, there are boxes to check for race, and the other box is provided in case the people filling out the survey find that they identify as a race other than the ones provided. Also, people who are ethnically Hispanic or Latino may choose other for this question because they do not identify with the races mentioned, and Hispanic is an ethnicity, not a race according to the Census Bureau. Next, looking at births to foreign-born women. The births to foreign-born women has seen a decrease since 2016 for New Jersey and Mercer County, but Trenton has had a 14% increase. More than half of the births to women residing in Trenton are foreign-born, meaning they were born outside of the United States. Next, looking at languages spoken in the home, the most recent data shows that in Trenton, 38% of the population over age 5 speaks a language other than English in the home. And of those ages 5 to 17 who speak a language other than English at home, during 2016 to 2020, 8.3% speak Spanish, an increase from the 6.7% during 2011 to 2015. In addition to this, while New Jersey has 7.4% of its total enrollment being English language learners during the 21 to 22 school year, Trenton's English language learner enrollment was 27%. Next, looking at some family economic security data. So when comparing the two 5-year estimates, it's apparent that the percentage of economically disadvantaged children has decreased for all 3 geographies. So for children who are identified as low income, their families have a household income of less than $52,492. Children who are identified as living in poverty have a household income of less than $26,200. And children living in extreme poverty are identified as living with a household income of less than $13,100. For median income of families with children, all three geographies have seen an increase in the median income of families with children, and Trenton in particular has seen a 6% increase, but it is still much lower than that of Mercer County and New Jersey. For unemployment rate, for all three locations, we can see that the unemployment rate was decreasing gradually from 2017 to 2019. Then in 2020, we see a large increase, most likely due to the COVID-19 shutdown. And then in 2021, the unemployment rate appears to decrease again. This graph is showing how much household income in each geography tends to spend on rent. As a rule of thumb, it's ideal for less than 30% of a household's income to go to rent, as this leaves money left over to spend on other necessary expenses and to also save for the future. We see that New Jersey and Mercer County both follow similar trends, and that 48% of households spend 30% or more of their income on rent. In Trenton, almost 60% of households are spending 30% or more of their household income on rent, and 38% are spending 50% or more of their income on rent. Next, looking at child health. So this table is showing the percentage of women receiving early prenatal care. Early prenatal care refers to the expecting mother receiving prenatal care beginning in her first trimester. As a whole, over 70% of New Jersey women began receiving prenatal care during their first trimester since 2016. In contrast, the percentage for Trenton women has not been as consistent, and in 2020, 47% of expecting women in Trenton were receiving early prenatal care. Here we have a breakdown of prenatal care onset of all live births in Trenton from 2016 to 2020. So from 2018 to 2020, we see the percentage of prenatal care onset beginning in the first trimester to gradually decrease from 55% to 47%. And we see that in 2020, the percentage of women receiving prenatal care in their second trimester has increased to 40%, and increased from the 33% in 2019. It's suggested to get prenatal care as early as possible, as this can help to deliver a full-term baby, as well as to ensure the mother has a healthy pregnancy. For babies born with low birth weights, a low birth weight baby means that the infant is weighing less than 2,500 grams, or about 5.5 pounds at birth. Babies who are born with low birth weights are more likely to develop certain health problems, such as respiratory distress syndrome. And fortunately, all three geographies have seen a decrease since 2016. Trenton in particular has seen a 16% decrease of low birth weight babies. Looking at infant mortality rate is the number of infant deaths per 1,000 live births. Here we have a breakdown of the infant mortality rate for select racial groups. Some racial groups are not shown here because the data was suppressed, and the reason for the data being suppressed is that for some racial groups, the number of infant deaths was less than 10, and by releasing that information, it may identify the family. But first, focusing on the average infant mortality rate, we see that Trenton's average infant mortality rate is almost twice that of New Jersey's. More disparities are apparent when we look at the infant mortality rate by race. We see that for all three geographies, the Black non-Hispanic infant mortality rate is much higher than the average for all three geographies. Next, looking at some health insurance data. So New Jersey Family Care is the state health insurance program, which encompasses Medicaid and the Federal Children's Health Insurance Program. Since March 2020, New Jersey residents enrolled in New Jersey Family Care have been able to maintain coverage without the annual redetermination of eligibility, thanks to the provisions specified under the nationwide public health emergency as a result of the COVID-19 pandemic. This accounts for much of the increase in the number of children receiving New Jersey Family Care. As of March 2020, Trenton has had a 17% increase in the number of children receiving New Jersey Family Care since 2018. The redetermination process is set to begin April 1st, 2023, meaning all members currently enrolled in the program will be reviewed to see if they still qualify for coverage. Families need to make sure that New Jersey Family Care has their most current address. It is important that households respond promptly to mailings from New Jersey Family Care to maintain health coverage. So for childcare, before we go on to the data, I want to provide some context about childcare center closures and reopenings. So on March 25th, 2020, the governor issued Executive Order 110, which mandated the closure of licensed childcare centers beginning April 1st unless they serve children of essential workers. On May 29th of the same year, the governor announced another executive order which rescinded Executive Order 110. This order permitted centers to reopen so long as they adhered to specific health and safety standards. The standards included limitations on the number of children who could be in the child care classrooms. The 2020 data is showing the number of licensed child care centers that were able to reopen by complying to the COVID-19 health and safety measures at the time. We see the impact of the executive orders reflected in the number and capacity of child care centers in 2020, and after 2020, when the COVID-related restrictions began to loosen, we see the number and capacity of child care centers start to increase again. An important note, the child care industry as a whole was very fragile prior to the pandemic. Many centers operated on constrained budgets, and the COVID-19 pandemic weakened this already fragile industry. ACNJ and fellow advocates have done a great deal of work at addressing the shortage of affordable, quality child care, as well as advocating for a stronger child care infrastructure across the state. Next, looking at child protection data. So the number of children under child protection and permanency supervision has decreased greatly for all three geographies. This graph in particular is looking at Trenton, which has had a 32% decrease in the number of children under CP&P supervision. Next, looking at some education data. So state-funded preschool enrollment saw a decline in all three geographies during the 2020 to 2021 school year because of COVID-19. Despite the enrollment numbers growing in 21 to 22 for both Mercer County and Trenton, the numbers are still lower than pre-pandemic enrollment. Currently, the Trenton district is serving 100% of its preschool-aged children. Trenton preschools allow children to be served in a learning environment while serving the community economy. Trenton's mixed delivery system is a model for New Jersey and the nation. For pre-K-12 total enrollment, Trenton Public Schools has interestingly seen a gradual increase in total enrollment from the 2017 to 2018 school year to 21 to 22. We see that the overall 5-year change is an increase of 30%. And when we add in the Trenton Charter Schools enrollment, we see that Trenton has seen a 23% increase in enrollment. We also see that from 2019 to 2020 to 2020 to 2021, Trenton Public Schools has seen a larger jump than the previous years in total enrollment. Next, looking at high school graduation rates. Trenton Public Schools high school graduation rates have been gradually declining since the 16 to 17 school year, resulting in an 11% decrease. The graduation rate data broken down by high schools for the 20 to 21 school year shows that both of the charter schools have graduation rates which surpass that of the state. Next, looking at post-secondary enrollment. When looking at this data, it is important to remember that the 19 to 20 and 20 to 21 school years are both COVID years. The pre-COVID years show that for Trenton Public Schools, the school-wide percentage of students enrolled in a post-secondary institution was 40%, which is lower than that of the state's over 70%. The school years during COVID cannot be compared to the pre-COVID school years due to the circumstances. National Student Clearinghouse has found that enrollment in a post-secondary institution has declined nationwide during these years. Next, looking at staff-to-student ratio. The American School Counselor Association recommends 250 students for every one counselor. New Jersey and Trenton Public Schools both exceed this, with Trenton Public Schools having a ratio of 419 students to one counselor, and New Jersey having a ratio of 339 students to one counselor. Next, looking at the teen section. In 2020, births to teens accounted for almost 10% of all births in Trenton. This is twice that of Mercer County and almost 4 times more than the state. Next, looking at juvenile arrests. In Trenton, juvenile arrests has been decreasing gradually since 2019 and has resulted in a 57% decrease from 2017. Thank you.
That was a compelling and informative presentation, and I'm sure it's going to take some time to really dive into a lot of the data to inform our actions. Good morning. My name is Jeff Vega, and I'm President and CEO of the Princeton Area Community Foundation. It's great to look out here in the audience and see so many supporters of the Community Foundation, including our Board of Trustees, led by our board chair, Sonia Delgado. Sonia, do you want to just wave? And we have a lot of our team here in our grants and program unit, led by Nelida Valentin, a Trenton resident. And we have several of our donors and fund holders in the audience, as well as many of our grantee partners. A lot to name here this morning, but thank you so much for coming together. I want to take the opportunity to thank our host today, the Smith Family Foundation. I'm wearing your color today, and several years ago, the Smith Family Foundation and the Burke Foundation began to support the work of ACNJ on the previous Trenton Kids Count report. For the 2023 report, we are proud to join, and I want to thank everyone for welcoming us into this collaboration. The data tells us so much about well-being of children in our capital city, and data is very important, right? It begins to drive change. It tells us that the number of Trenton children living in poverty and extreme poverty decreased between 2016 and 2020 compared to 2011 and to 2015, and the median income of families with children increased during the same time frame. Yet, we still know that many families in the city are struggling. From 2016 to 2020, the median income for families with children in Trenton was $34,754, while the same figure for Mercer County was $108,877. During that same time frame, more than 1/3 of the city's children live below the poverty line. This data tells us that there is an urgent need for all of us to work together to improve the lives of children and families. To that end, the Princeton Area Community Foundation will bring to the collaborative a piece of the puzzle. It'll bring our leadership, our resources, and lessons learned from several initiatives, including our All Kids Thrive partnership with local schools and nonprofits, which has implemented several models to understand how we can reduce chronic absenteeism. And we certainly, during our journey, learned the importance of data. In the middle of our initiative, COVID happened, and the name of the game of trying to get those models to remove barriers to get children to school had to switch to making sure children and families had what they needed as they were beginning to learn remotely. And in the middle of that, schools couldn't take attendance or started to take attendance differently. And you saw from the presentation that chronic absenteeism couldn't even be collected. So we know the importance of data, especially in the All Kids Thrive project. We will also bring the lessons learned from our most recent round of grant making. Last week, we announced $2 million in grants from our Community Impact Fund and our COVID-19 Relief and Recovery Fund. Those grants were awarded in several critical needed areas, including food insecurity, education, and youth development. You can applaud for that. We also bring a lot of collaboration within the Community Foundation. There are other fund holder partners, other programs like the Bunbury Fund, which seeks to build the capacity of nonprofits to do even better what they do in the communities that we serve. We also have the Fund for Women and Girls that bring together women and men philanthropists together to join a pool and give dollars to causes that are helping economically and disadvantaged women and children. So we bring a lot of network of donors and fund holders that want to do good in partnership with the community. At the Community Foundation, we believe that thriving philanthropy leads to thriving communities, and together we must build on the work of this report and work collaboratively to ensure that all of our children can thrive. Now, we have a terrific group of panelists who will help us think critically about what we can do to help our community move forward. You can read more about their bios in the packet that you have with you, but let me take a brief moment to introduce them. First, and as I introduce you, feel free to take your chair at the panel, please. First, we have Dr. Rachel Evans, who is the Chief Medical Officer at the Henry J. Austin Health Center, a federally qualified health center that makes critical health services available to many in the city. We also know we have a leader in Trenton Public School Superintendent James Earl, who is here represented by Denise Crease. Denise, come on up. Denise is especially important to us as she is the lead with our All Kids Thrive through Trenton Public Schools, has been a critical partner in setting up Parent University, the parent attendance teams in all of the schools, critical partner in improving the education of children in the city. Next, we have Assemblywoman Verlina Reynolds Jackson. She represents the 15th Legislative District in the New Jersey Assembly, was formerly a city councilwoman. The Assemblywoman has a strong record of sponsoring legislation that supports the well-being of children, including she was a co-sponsor of the chronic absenteeism law that went into effect the year we kicked off All Kids Thrive. Welcome. And of course, we are very happy to be joined by Eleanor Horn. She is here today as the panel's moderator. Eleanor has been part of the Community Foundation for over 20 years, and we proudly designated her as a trustee emeritus in 2021, being one of only 3 that have been given that recognition. She remains deeply involved in many initiatives that help to improve the quality of life in our communities, but especially she remains involved with our All Kids Thrive initiative. And I got to tell you, I am the self-appointed president of her fan club. So I'll turn it over to you now, Eleanor. Thank you.
I am absolutely delighted to be with you today to continue a community-wide conversation about the future of Trenton's children. Now, to a large extent, we have focused on numbers. But I want to remind us that Behind every number, there are hundreds, if not thousands, of children. And we cannot really do justice to the numbers without thinking about the little lives that are behind those numbers. And I am so delighted that we have children's artwork behind us to remember the value of each and every child behind the numbers in Kids Count. Before turning to our distinguished panel, I want to remind us of how fortunate the Trenton community is to have a Kids Count report. Trenton is one of only 3 cities in New Jersey to have the benefit of a Kids Count study. For that we owe a deep debt of gratitude to the Smith Family Foundation and its partners, the Burke Foundation, the Princeton Area Community Foundation, and Advocates for Children of New Jersey. Now, some of you may think that we have overdone our giving of thanks to our sponsors, but think about this. If it were not for them, not a single one of us would be in this room, and not a single one of us would have the opportunity to use a rich data set to guide the work that we're going to do as a result. Now, you know, the report is extremely valuable. It is a comprehensive reference, and as you've pointed out this morning, there are other data sets that you would like to see included in the report. Shame on you if you don't follow up and send your suggestions to the folks who are going to do, hopefully, the next Kids Count compilation. But it would be an even greater shame if we sit here today and listen to the data and then don't do a damn thing about it. So think about the report as a comprehensive reference, a baseline to measure progress or the lack of it, but also think of it as a statement of our commitment to our children. Or if we don't do anything, the next report will be a statement of our lack of commitment to our children. Now, I'm not saying that data are not important. I strongly believe in data, but data are useless if we do not use that data to make decisions, set priorities, and hold ourselves and each other accountable for what we do and do not contribute to our children, to how we prepare them for a future that we can only imagine given the rapid rate of change in every sector of our lives. What we do with the data is most critical, and to do nothing cannot be an option. So it will take concerted action by the entire community to make the changes that our children deserve. And if you look around you, we have every part of our community represented. Think of the power in this room if we work together to use the data. And it will take us working together to make the changes that our kids deserve. So our panelists this morning represent key players in our community. Represented is the medical sector, the education sector, and the political sector. We all can agree that there is little that impacts our children that does not cut across these 3 sectors and that does not require the cooperation, support, and advocacy of not only these sectors, but all of you. So the panel is designed to spark our thinking about our response to the report, beyond wringing our hands and bemoaning the fate of our children. After this day, we expect everyone in this room to do something concrete to improve the outcomes for our children, all of our children. So as you listen to our distinguished panel, begin thinking about what you and what your organizations can do individually and collectively to benefit our precious children. I want to thank Denise Crease for stepping in at the last moment in the absence of our superintendent. But if you know anything about Denise, you know that's what she does so many times. She fills in the gap, whatever that gap may be. So thank you, Denise. So now let's start our questions. And I will invite you to jump in at any point, whether you agree, disagree, or have a different perspective. So one of the early chapters of Trenton Kids Count provides data on our children before they are even born. Dr. Evans, why is it important to begin our concern for our children from conception through the earliest stages of their lives? What is the benefit to them and the return on our investment in supporting the early development of our children?
Can you guys hear me? Oh my goodness, yes. Good morning, everybody. And thanks again to all our supporters. This is an amazing event, and it's amazing to see all of you in the room. I think there's a lot of ways to answer that question. And I'm speaking, of course, from the healthcare sector, but we are always talking about the social determinants of health. And we're always talking about the fact that as a physician, I might be a wonderful diagnostician, or maybe I'm not, but hopefully I am, and I might come up with a great plan for my patient. But that doesn't really matter. What matters is my patient's plan for themselves and where are the structures that surround them. So if we're going to talk about a child and how healthy is that child, how healthy their parent is, how healthy the pregnancy is, and I would actually say you have to go before conception. You have to look at all those structures. The pregnant woman, what brought her to that moment? Is it a wanted pregnancy? Is it a healthy pregnancy? How do we support the family? How do we support the community? So these things are really inseparable from the health of the child that we're talking about. And I think for me, and this is really the theme of looking at this data, as you've already sort of called out, it's not so much about the service and that moment of accessing the service. It's about everything that leads up to and everything that follows from that. So thinking of access to prenatal care is so important. Henry Johnston does not provide prenatal care, so it's easy for me to talk about, it's hard for me to do anything about, but I can say from the healthcare perspective, healthcare is a deeply hierarchical institution, and it is built to create the outcomes that we see. And part of the challenge is it's not enough to say, okay, we have a service, we have access. What does that access mean? If I am a pregnant woman, if I am the parent of a small child, and I think my child needs something, what are the many, many barriers between connecting my child to the answer to that need? And we know that the healthcare system is full of those barriers. And I already heard the words of talking about community doulas helping to navigate that system. And that's a lot of my responsibility as the chief medical officer of a health center, is really thinking about, maybe I have great providers, great teams. It doesn't matter if people can't see them. And it also doesn't matter if that plan of care, that moment, doesn't get followed through for all the many, many reasons that things don't always get followed through.
Thank you. Assemblywoman?
I just want to chime in. So yesterday was Maternal Health Awareness Day. And so I'm like boiling, percolating over here because I'm just ready to jump in and talk about all the things we talked about on the call with another organization, Salvation and Social Justice, and Mellon and Mothers. And we're talking about breastfeeding. And we're talking about all of the positive things that happens to the baby, the reduced asthma, obesity, type 1 diabetes, lower respiratory disease, all from best breastfeeding. And I think the doctor talked about, what the services you receive before you're pregnant, breaking down those cultural biases to say breastfeeding is great. It is. And then also I think about, those doulas and midwives and who look like us, who can say, yes, it's okay to breastfeed. This is what we've culturally done for thousands of years. Reintroducing these things, and in the shortage of formula, I was saying, mothers that are breastfeeding are like, oh wow, I'm in a much better place. I know people still freeze it, to be able to have it and things like that. But I was really, thinking about your location, where it is in the heart of the city, making sure that we provide the best care we can and bring more services. The Henry J. Austin is that healthcare center where you can go for healthcare services just to make sure you're okay. We know we have high obesity rates because of our food insecurities. We don't have enough fresh produce, but we have probably thousands of corner stores and bodegas that don't have the equipment to have fresh fruits and vegetables, to be able to give those options. We think about these early stages of life and how we want the best. But we have to take care of ourselves too. And I think that mindset of taking care of yourself. So if and when you become pregnant, it's okay, I'm ready. And if not, what do I need to get ready so that we can be able to have a healthy baby, no matter what stage you are. And so I just wanted to jump in and share those few words.
I have to acknowledge that from the time you entered the assembly, you have been a staunch advocate for maternal and child health. And some of the programs that we see in Trenton are the result of the work that you have done. So thank you. Education has long been considered the exit ramp from poverty and the on-ramp to the middle class and the stability that it brings. Ms. Kreese, Trenton has a nationally acclaimed preschool program. Many of our children get off to a strong start. Why is it that early advantage is not sustained once kids enter school? What do you think that schools and the community must do to ensure that our students build on their preschool experience?
So when I saw that question, I had to reframe it in my mind to fully grasp the breadth of what you were asking. And I don't think that our preschool program entering K through 12, not that we're not sustaining it, is that there's levels of disruption that's happening due to the lack of access of health, sorry, of health assistance, food insecurity, not being able to access health care, increase of homelessness, limited opportunities for employment. So those are all the reasons why I thought in my mind, what's happening in our community. There's also exposure to lead, as one of the participants had mentioned before. There's mold in our homes, increase of pests. That all impacts the child's livelihood in the home and going into school. So some of the things that we could do as a community is just to continue to do what we're doing today, having the conversation, continuing to strengthen partnerships, to increase access. So continuing to just advocate and promote and share. We know that the online platform has increased through social media, and just on a grassroots level, continuing to knock on doors, flyers, and meeting people and parents where they're at.
Denise, you've done some really exciting work in your role as a parent coordinator. Would you share with us some of the ways that you've been working to prepare parents to be supportive of their children's school experiences?
Absolutely. So we, as Mr. Vega had mentioned, started Parent University, which we call Parent Connect. So these are parent educational opportunities for our families through trainings, workshops, professional development, and offering parents as leaders workshops so parents can learn how to advocate and navigate between home and school. We're excited for this new series that we started in the beginning of January. We're working with Mercer Council on substance abuse and alcohol on the Family Strengthenings program, where parents are learning how to increase their child's courage and confidence. So they're doing lessons on strengthening communication, coping mechanisms, on anger management, how to optimize on family time, and giving the parents homework. It's just been really fun, and they're doing lessons with the children as well. And so they're separated into groups. And thanks to the funding of All Kids Thrive Grant, we've been able to provide dinner and childcare opportunities for families that are not able to participate. Now they're able to participate, and through Mercer Council, they've actually been transporting parents to the Board of Education so that they can participate. So it's meant to be a small group of families, so we have 12 families participating, and it's just amazing to see the growth. This is one of many series that we have been executing. We're also going to be offering our second annual Parent Connect Summit, where we're going to offer district-wide parents the opportunities to navigate various workshops, and we're looking to do it on school safety, immigration rights, social emotional learning, and mindfulness and yoga. And so we're really excited for that, and we're going to have community partners available too to share resources. So that's a piece of the work. I mean, I could keep going and going and going, but our goal is to just work with partnerships to increase parent engagement, which is an indicator to reduce chronic absenteeism and assist with the student just feeling, being able to be more confident to achieve and graduate. Ultimately, that's the goal.
Did you want to add to that, Rachel?
I was just thinking, as you're talking about partnerships and all these complicated factors, two things I wanted to highlight from the presentation earlier. The idea of the potential mass disenrollment event in April for our families who are on Medicaid. This is a great example of how everyone in this room really cares about all these things we're talking about. And if we're highlighting access to health care as one of the reasons why children have a hard time in school, and then I'm also looking at, we talked a little bit about housing insecurity and indicators around that, and there is in the report an indicator about percentage of households that are spending 30% more on rent, of their income on rent, and that's around 60% in the city of Trenton. That's huge. And so you have to picture, you have a family, maybe they're a one-income family, they're spending 30% of their household income on rent. All of a sudden they hear that their kid can't go to school anymore because they're not vaccinated, right? And they have to try to get access. At the same time, suddenly they don't have Medicaid anymore. So what can we do about all this? Well, it's very difficult because the process is, in order to avoid disenrollment, the family has to respond to a letter that was sent to their home. Now, I am going to disclose that I have not successfully navigated my health care benefits in the past 3 years because it required doing something with mail. And in theory, I'm a high-functioning professional. And so I think about these families that are spending all their time trying to meet their rent. They have to respond to a letter that's sent to them, sent to the address before the pandemic. How many of our families are at that same address? Or they have to somehow get the message that they have to call a number to update their address, probably during working hours, probably not in the language they speak, possibly. Somehow make that happen, then get the letter at their home, then follow through all the rest. It's not an easy application. And then as sort of a related concept, we have this wonderful new legislation that many of our undocumented children are now eligible for MJ Family Care, which is great. Yay, worth the fighting for. But as Dr. McGrath mentioned, what does that mean about oral health? What does that mean about pieces that are maybe not covered even once you have that coverage? And so it's so important to keep talking about these pathways because there isn't a single thing that any of us in this room, or maybe some of us, can do about that requirement to respond to something mailed to someone's home. This is one of these bureaucratic structural things that is going to have the worst impact on the most vulnerable community members. And it's just one example, but the impact is potentially huge.
And I think that's why these conversations are so important. We don't make up legislation, but the barriers that exist, we know are systemic. We know they are real. And this is why part of Eleanor's call to action for all of us is to let people know that you must act on this, because this is going to have ripple effects through generations. And then just to think about the barriers you have to go through to get re-enrolled, right? So those are all things that are going to stop and hinder us down that pathway.
As you read the report and listened to Elena's summary of the data in Trenton Kids Count, what struck you as the one or two issues most in need of immediate attention by your sector as well as the whole community?
For me, I would think there's two things. I got a list. I started taking notes during the presentation, and Ed's elbow is probably hurting. Someone's like, "Hey, what about this? And what about this?" But economic justice. We've heard the housing costs. We've heard about $15 an hour does nothing for you in New Jersey in terms of rent and a decent place to live. We're not even talking about utilities and food, groceries, transportation, gas, internet access, and the list goes on and on. So I would say economic justice is one of those things that definitely sticks out in my head. And also education, worldwide access to great education. During the pandemic, the veil was ripped off on how some of our school districts are just not equipped. Trenton was running around with some paper packets where others were able to flick a switch and they were online. And so it took us time to catch up, but look at the gap in learning that happened during that time. And so as we're trying to fill the gap and come up with these different ways of making sure our students stay on track, I also think about how others, are excelling in that space. And so we have to double down and make sure that we come up to par. And I think in the legislature, we absolutely must do more work to support those schools. But when I think about when we talk about education and then that access, the funding formula, the way it works, if you have a program that's doing well, then the funding goes away. Well, how am I supposed to sustain all of these great works that we just did if you take the money away? And so, it's supposed to go to another program. But we have to figure out how do we continue to fund it so we continue to do well. And that's a hard road to go down as well. But I think about our youth-based services programs. The state wanted to be able to reinvest those dollars, but it was the screaming from the Trenton School District who reached out, who really doubled down, and we really worked with the governor's office and the commissioner to say, no, these services must stay. And I'm talking $36.9 million for our statewide programs for school-based services, which is extremely important. It goes to some of the programs that Denise is talking about over here, and we have to keep our eye on those type of inner workings, what happens and how we want to thrive. So economic justice and education, access to worldwide educational services is what we must demand in our district and be able to continue those funding levels so that we don't go back to where we came from and we can continue to excel. Our students do very well in traditional careers, but there's also a whole world in non-traditional careers. Manufacturing is huge. And so to expose our children to those careers as well is life-changing for someone. There's so many different things that I'm learning myself, and so I want to share everything that I learned with our school district and say we should do a career fair on non-traditional schools. What about these type of programs? What about these alternatives? Did you know that Mercer County has an aviation program? Like, you don't have to go to the Air Force to learn how to fly a plane. Like, you can do that. We're supposed to be giving this information, encouraging our students, but if we don't bring it to them, it does us no good to keep all of this information in these four walls.
Denise, I bet that Verlena's comments are making your heart sing. What would be on your wish list?
Yes, that students just continue to take advantage of the programs that are available, because there is so much that it's almost like peeling back that onion. Like, people don't realize the core and what's on the inside, and there's so many great things that are happening They have the medical department at the high school, they have the restaurant and business, they have communications, and they're working on their own talk shows. I mean, it's amazing some of the work that's happening, and we have so many talented students, visual and performing arts, just to name a few. It's just, we just want our children to do more, to do better. And what stuck out for me was the graduation rate. Like, okay, and in my mind, what can we do to make that number increase? And again, I'm just going to reiterate, just continuing community partnerships and mentorships and internships and apprenticeships that are happening. I think just to, the elephant in the room is, how do we also reduce violence that's happening in our community in order for students to feel safe in school? So, because our kids can't thrive and learn if they're not feeling safe in the community. So it takes a village. So those are the things that I was thinking about. And then another striking data point, which Dr. Evans had already mentioned, was the rent median, because that's impacting homelessness. There's such an increase of our families, because in the district, my role is a homeless liaison. So I help to assist students to receive equitable services such as transportation, mentoring and counseling, and ensuring that they have school uniforms and food, and connecting them with social service agencies. And I will say, over the course of the 5 years, that number has almost tripled. I get a referral at least, a few a day. And before it was maybe 1 or 2 a week. So I know that this is impacting our students' ability to learn and thrive, because they're, bouncing from hotel to hotel. And then, with the way the Board of Social Services works, which is wonderful, they're able to place them in a hotel, but unfortunately, they're being placed outside of the city of Trenton. So then that just becomes even more, a greater impact. And luckily enough, the district has gotten a lot better with transportation. So we're transporting students that are Piscataway to Trenton, because that is the parents' right to keep their child in Trenton Public Schools. And we want to keep those babies in our school district. So it's appalling. But I think we have a lot of work to do. And I'm willing to support, organizations, to spark conversations, and just to continue to expand on partnerships.
Thank you. Rachel, what's on your wish list?
I got a long one, too. I think we all do. So speaking from the healthcare sector again, and looking again at all these wonderful people and organizations in this room, I think it's important to highlight the success in terms of childhood poverty. So it's really great to see those numbers having shifted. It is so frustrating to see infant mortality for Black women and children still where it is compared to white women and even Hispanic women. And I think, and having worked so intimately with many organizations that are working on that closely, I think it's important to highlight. So I'll speak to Ed Henry J. Austin. We have, with the support of the Burke Foundation and other foundations, a Centering Parenting program, which does group visits for children and their parents under the age of 2. And this is a model that has been shown to decrease inequities in other similar communities. Why does it work so well? Well, probably because it changes the locus of power. So what this program does is the person in the room who's important is not the doctor or the healthcare provider. The person in the room who's important is the parent in that group of parents. And it really shifts, it takes that hierarchical power structure and turns it on its head. And every time we're able to do that, whether it's in the healthcare setting or out in the community with a program like Family Connects, that is what starts to move the needle. Because as I've said, our structures in healthcare are built for the convenience of the healthcare providers, of the healthcare organizations. That's just how it's built. And then when you think about what's funded, it's the traditional services that are funded. What does Medicaid pay for? What does the uncompensated care in New Jersey, which we're so fortunate to have, what does it pay for? It pays for traditional medical services. It's always plus minus if it's going to cover behavioral, dental, et cetera. And now let's talk about the connecting pieces. the doulas, the community health workers. These are things that we fund on a shoestring, we fund on a grant. That sustainability piece is always the question. So on my wish list from a healthcare perspective, these partnerships, these programs where we reach outside of our silo and we say, help us with healthcare has an institutional racism problem. We know that that's how it's built. If you call Henry J. Austin, and I'm just going to speak for Henry J. Austin because I can, we push against this every day, and it's a challenge. I trained as a physician, and what you learn in that training is the patient is the other. That's just the way you get trained, and your goal is to sort of try to navigate that every day. But what does really advocating for the patient and the family mean? It means pushing back against all that training and pushing it back against those structures. So this is sort of a long-winded way of saying, let's support the things that we know help push back against those inequities. So whether it's funding community doulas, funding community health workers, we're working on making centering parenting a reimbursable service because it still is not. And that drives what happens. Each of these things, if they become reimbursable, that they become sustainable. We're looking at trying to find support to implement screening and for the social determinants of health because we know that all of this is important to health outcomes. So I think that's continuing to think about those partnerships and roles and healthcare delivery modalities that are non-traditional and making them sustainable is really important. And I also I would love to, while we're talking about good news, I did want to point out all this fabulous artwork behind us, which was done by children in our schools, and it's part of an initiative that we would love everybody's support with called Vision to Learn, which is a partnership between the school district, Henry J. Austin, and an organization that does universal vision screening and provides eyeglasses. So the goal is to fund this initiative, and as part of this, we had a fundraiser, and our development team did art workshops with the kids. And so please come take a look at these, they're amazing. And you can go to our website if you're interested in participating in that initiative, because of course, eyeglasses are something else that aren't covered. And it is just life-changing. And when you think about how many of our children are struggling with vision in the classroom, such a basic thing, but there isn't that sort of official funding for it.
And I will say that Neha came to one of the Parent Connect sessions and did a lesson, and some of the artwork was submitted through that series.
Oh, thank you. That's so lovely. Thank you.
So I just wanted to add that is something that we're working on for eyeglasses, and also we have a bill out that we're working with Dr. Barnes on for oral health care for moms. These are things that we kind of take for granted, but when you think about some of the challenges students have in the classrooms or the distractions, I've been wearing glasses since I was in kindergarten. So, if I can't see, this is a bad thing. And so you think about, having access or to know I need to go to the dentist, my child can start going early, vision is just important, and these are the things that may need to be addressed in order for the student to do well. And again, it's about awareness, and I think we're all talking about advocacy and how we talk and try to get this information out that we can do this. But I said, let me find out Dr. Evans on my paper over here. I put there increased Medicaid reimbursements. Because we're coming up on budget season soon. The governor will be doing his state of address. And so we hear this all the time that these reimbursements aren't there. And so it makes it difficult for agencies to be able to provide services if you're providing this quality care and still everything is going up, if not 50%, 100%, from supplies and billing. You have to be able to readjust. And the longer we wait to make this increase, the harder it becomes. It's like savings. You can't decide today I'm going to retire if you haven't had a retirement plan, and then you find out, oh my God, I can't retire. Like, you have to begin these conversations now. We have to get caught up on these Medicaid reimbursements as well.
My next question. The fact that Trenton Kids Count reports data by race and ethnicity signifies that race and ethnicity, or better yet, society's response to race and ethnicity, are major contributing factors to the realities and outcomes of our children and their families. I ask each of you, how do we as a community address racial and ethnic disparities as part of improving the life experiences of our children?
We begin to have these conversations. So I know there is a big push for us to talk about our history, and history being inclusive of all, Black people, people of color. We have to be able to uplift that in a way where we are being respectful and it's not whitewashing over our existence. And I think our students have been, and our children have been yearning for this. We've seen the protests, we've seen them speak out, and we know it exists. And so I think it's up to us as adults to be able to continue those conversations and empower them to speak up and to speak out as we do often. I think our district, every industry right now is struggling, but we're all struggling with teachers. We have an initiative out to recruit Black men for schools and teachers. And so we ask you to look for creative ways. We know I forget the statistics, if a child has a teacher that looks like them, I think it's by the 5th grade, they are more likely to graduate from high school. And I believe that. And I think if you think about who your favorite teacher is, I know my favorite teacher is Gail Banks. I love her to death. And I've had many others that have looked like me, who have been in my head, someone that I admire and look up to. And so I think exposing our kids and thinking about teaching as a career is one that we have to continue to push as well, to be able to say not only can we be a student, but we are also leaders in academia.
And I would just add to follow up, it's, for healthcare, it's so important to have everybody who is working at our healthcare center not just hopefully represent or look like the community they're serving, but also always be aware of the ways in which things are structured and how we have to question that. So I'll just give a really concrete example. If you show up late for an appointment with your nurse practitioner, what happens? Well, after a certain period of time, it's going to be hard for them to see you, and that's just a fact, right? Because you've got 20 to 24 people scheduled. However, we know that because of all the factors that we've been talking about, all the social determinants, if you're Black or you're Latinx, you may be more likely to have a transportation challenge. You may be more likely to have a child care challenge. You may be more likely to have trouble getting off of work. So when you show up late for your appointment and we say, well, we can't see you, you should have been accountable to your appointment time, what we're saying is we're not looking at all the structures that are stacked against you, and we're not trying to solve them with you. And so our conversation around that is, yes, I know it is very annoying that all 5 of your patients just showed up at 3 p.m. What are we going to do about that? What can we do about that? It's not going to be perfect, but it's not just a question of the convenience of the team or the accountability of the person who had the appointment. It's really, we're talking about racism. We're talking about socioeconomic status. We're talking about, often for our female patients, what are they doing as a single mom? What are they up against every single day? That kind of concrete questioning of, 30 minutes late, let's cancel them, is just one small example of the kinds of changes you have to make every day.
And I also think that we have to look at how can we make services equitable, and so that there's an even playing field for everyone that is in need to receive those services, whether it's health services, and even in the education sector, trying to get a child registered for school sometimes can be a tall order. So we're working on that piece in the school district, and we're working on a plan to centralize registration, so that'll be another conversation. But I think that continuing to opening up access in the community centers, and I think there's so many nonprofits that do such a great job of just opening their doors so that families can access services.
And just one other thing. I think, and I'm going to go way out of my lane because this is not just about healthcare, but we like to talk about trauma-informed care. And I know when I work with the schools, we've talked a lot about trauma and resilience, and what is that magic formula? One of the other things that we see in the well child visit, where we're seeing kids as they grow up, for many of our for example, our Spanish-speaking recent immigrant families, Trenton is the place of hope. So they've experienced horrific trauma, and living in Trenton is the dream they had. That's very different from many of our black families, where the dream they have is to leave Trenton, and they don't see a future that is hopeful for them within the city. And that narrative is so powerful, and that question, I love this conversation around what other options are available to me, what can I see? Because when the adults in your life also don't have that hope or don't have that vision, it becomes so important for us to find a way to create that hope and that vision. Because regardless of the trauma you've experienced until that point, what you see ahead of you is so powerful, and we can all have a role in that.
Okay, let's now turn to the audience. Do you have questions for our panelists? And Tyrell would like you to meet him in the middle.
Good morning, everyone. Thank you for being here. So, my name is Sherelle Snyder. I am a community organizer in the East Trenton neighborhood. And I get to see what our parents and our children are going through in a really poor neighborhood. So, I gotta relax. As we all know, poverty, poor housing is a big problem in Trenton. But me and the people that I work with, we seem to think that lead is also a really big issue in Trenton. This issue, if we can curb it, can help our issues with children in the school, their attention deficit disorders, their poor IQs, their poor standardized testing scores. Lead, we have lead in the soil, we have lead in the homes, we have lead in the dust, our lead service lines. So our kids are not only breathing in this lead, they're ingesting this lead. I would like to work closer, we would like to work closer, East Trenton Collaborative, Lead Free New Jersey, with Henry J. Austin. Probably you have a mobile van. If we can take that mobile van, so my question is, would you be willing today to partner with us to get that mobile van out so we can test our children?
Thank you.
And I just want to respond to that briefly. I love that idea, and I'm going to circle it back to when we talk about those reimbursement streams. This is where it gets really boring. Point of care lead testing, meaning the kind that's easy to do. You go into a community on your vehicle and you offer testing to anyone who walks up, is not reimbursable through any funding source right now. So if we were to say as a health center, we want to screen every kid, every family in East Trenton and West Trenton, all over the city of Trenton, we'd be doing it for free. And that's true of so many kinds of initiatives like that. So it's that question of sort of connecting. If we know there's a need, if we know there's a problem with lead, what do we want to do about it, and how do we create that sustainable plan? So, yeah, but yes, let's talk offline. Thank you.
And that's identifies a role for philanthropy to help to subsidize the things that government in its stupidity will not pay for. Well. Now you know we have a bill for that too, Miss Eleanor. and Miss Snyder, let me find out you've been on my paper too, because I just wrote down strategic plan. And so the strategic plan, this is like, we're still in January, we're still saying that until February 1st, I'm still saying Happy New Year. We're all here today to think about what our strategic plan and what should be included in the year. And housing is a part of the strategic plan. Lead is a part of the strategic plan. Food securities is a part of the strategic plan. Why shouldn't we have new housing stock? Why shouldn't these old houses come down? Why shouldn't landlords be responsible for not only saying I have lead, but you are now mandated to fix this lead? You know, there is a process. It's going to cost, but that is the responsibility when you become an owner, when you have a business. You have things that you are liable to do. And so
Sherelle, follow back up with me so we can have you down at the State House to testify and advocate for these lead bills, because it's a whole package of them, and we have to continue to press this. You remember, everything is about accountability. I can't do it by myself. I need 41 votes to do that. And so you have one in the room. We need some more friends that says this is a priority for the state of New Jersey.
Thank you. Next question.
Hi, my name is Danielle Glito. I'm the founder and executive director with One Simple Wish. And I have to say, like all of you, I love data. I think it's very important. But Eleanor, what you said resonated so well with me, because I might be a founder or ED of a nonprofit, but my most important role in this entire world is that I am a mom. And if we take this data and we do nothing with it, then what are we really doing for kids? This organization that I have is all about removing simple barriers, and I think it's something we don't talk about enough. Things like making sure kids have access to hopeful situations, joy, activities, connection, love, and a lot of times, and I'm sharing this because a lot of people in this room probably don't even know that we're a resource. We are national, but we work with thousands of agencies, social service across the country, but we are trying to do more here in the city of Trenton. So really, if anybody here is working with kids, and there are simple barriers we can fix, a lot of times, things like kids not showing up for school are as simple as having clean clothes, or getting a haircut, or connecting them to a sport so that they've got a reason to go. Organizations like ours fund these without any government support, without any foundation support. We do this through individuals and corporations, and so I encourage people here to really think about how can we also remove simple barriers. Kids should know joy. Kids should have hope. Those are just as important as all the other things we're talking about today. So I just wanted to come up here and make that point. So we're here if you need us. Use us.
Thank you. Next question.
Thank you. Dr. Nicole McGrath-Barnes, founder and CEO of Kindersmall Foundation. This is truly a breath of fresh air to hear the panelists talk about access to oral care. We've been fighting for the last 15 years with our organization, and so I just want to thank you guys. We talk about absenteeism rate, how high it is in Trenton compared to the state of New Jersey. Do you know that 53 million hours of school are missed annually due to oral disease? So lack of access to oral care, that is huge in terms of children going to school, right? If they're in pain, the mother's going to bring them to Capitol Health, right? They're going to miss school. How many of us have experienced dental pain as adults? Can you imagine what a 2, 3, 4, 5-year-old who can't articulate that they're in this kind of pain? So please continue to be the champion and advocate for access to oral health care. We talk about increasing Medicaid reimbursement and MCO reimbursements. Also, do you know that a lot of MCOs only pay $6 for an emergency dental visit? $6, less than what we pay for a cup of coffee. So that is also huge. And perinatal, our perinatal health and wellness program that's supported by the Fund for Women and Girls, mothers who are undocumented, we have to educate them on the access to oral care and how oral health is the gateway to total health, because that contributes to low birth rate. So I want to thank you guys and really applaud you and everyone else in the audience to continue joining me in being a champion for access to oral health care. So thank you.
And you know, Nicole is the Trenton Tooth Fairy. Tammy?
Hi, I'm Tammy Brown here again. Welcome, representing Metro World Child. I just had a quick question. I had some thoughts of things. I just want to know the date of when they have to re-enroll for health care, because we do have a large text blast. We're in the community. If kids get in trouble, we go to school with them. Not only that, we do grassroots, so we go door to door. We have a truck that turns into a stage in which we take into the community, and we're doing programming with them. So we have a lot of access. We have gained a lot of positive feedback from the community, including even gang members that say it does something to their heart the way that we come out there and we love on their kids and we're trying to help them. We'll show up at school. Wherever there's a concern, we show up with parents as well. We partner with Chick-fil-A, Target, Ewing Police, Trenton Police Department. So we've got a lot of feedback, and gang members actually do bring their children to our program. So we get a lot of data, we have a lot of information, addresses. So we would like to kind of send this out on our text blast and say, hey, if you have to re-enroll, with this healthcare, if you can let us know the dates and everything, we'll get that out to them just to make sure that they do that.
It's April 1st.
April 1st? Okay.
And if you look at the NJ Family Care website, there's a hotline number. They have sort of the brief information about what families specifically need to do to call, update their address, and then just keep a lookout for that mail when it comes. Henry Justin and the Trenton Health team also have resources on their website about just that very specific data. And yes, absolutely, anybody who can help amplify that message, because I know so many of our families haven't heard it yet.
Thank you, and that's great because we had a large population of our children in one building on Eisenhower that was displaced due to heating issues and other issues. So we like to make sure that you all can trace them, they can be able to get the services that they need. So thank you so much. That was my only question.
And thank you for your questions. Our time is ending. I'd like to thank our panelists, Denise Priest, Assemblywoman Berlina Reynolds-Jackson, and Dr. Rachel Evans. And so in summarizing what I've heard from our panelists and from you, I have some ending comments. Number one, the issues that impact our children are integrated. It can't just be education or health care. It's everything together, housing, transportation, what have you. Secondly, we're focused on the whole child and his or her family, and that's part of it all being integrated. Third, I want you to think of everything that you do in terms of how it affects our children in school, because school is the place where everything good and bad in the community comes together, and they have to deal with it. So you may be a housing organization. Think about how what you do impacts kids in school. Another thing is the importance of partnerships. None of us can do this work alone. Another point is to vote. Verlina talked about all the things that are in the assembly. People need to know what we care about, and part of the way we do that is to vote and to be an informed voter. This is not about the personalities of people who are running for office, but what they stand for. And then finally, we have to speak up, we have to speak loudly, and we can't speak just once, but as many times as it takes to get the attention of whoever it is that we're addressing, because we're speaking for our children. So panel, thank you. And again, thanks to the Smith Family Foundation, the Burke Foundation, the Princeton Area Community Foundation, and AIC, the Association for Children of New Jersey. Thank you all.
We have a very, very special guest with us today. And why don't we give another round of applause to this amazing, enlightening, wonderful panel of women. Thank you. I'm pleased to introduce our Trenton Mayor, Mayor Reed Gusiora.
This data book sits on my desk, and it's a wonderful resource, and I think everyone should keep it close to them. Just to remind of all the challenges that Trenton has. One of the things that we tried to do was use ARPA dollars to get into health benefits and to expand the access, and that's why it was so important to open up a neighborhood clinic. It was so important to engage teens. This last weekend I was at a DC mayor's conference, and one of my first youth council members is now a junior at George Washington. And it was so great to see the success of our students. And you have to remember that the majority are doing the right thing in the capital city. But what we need to do is reach out to the ones that need the hope, that need the encouragement, and to know that they too can make a difference in our community. So this is a distinguished panel. It's great working with Verlina and the Trenton Health team to make sure that we are engaging in the community, and we look forward to the continued partnership in the years to come. Thanks so much.
Now, closing remarks by our CEO, Ms. Catherine Nutley.
I want to say two things that's really important before I say my speech. One, we're going to have to vote to see who's the president of the Eleanor fan club, because she's awesome, so we'll have a vote later. And number two, the young person that the mayor was talking about is also our scholar in our I Am the Change program. And you'll all be happy to know that she scored an internship at CNN in Washington, D.C., so we're very, very proud of her. So, my speech. Thank you all for staying so long. It's going to be, everything is awesome. So, at the Smith Family Foundation, we have a signature grant that we call Forever Forward. This is an extraordinarily, extremely competitive 3-year fellowship where we stretch organizations and their leaders, taking them from passion to impact. We just graduated our first cohort, and it was a challenging 3 years, especially working through COVID. There were many times where some of them wanted to give up, but we had to remind them, your organization has come too far. We talked about how setbacks are a part of the life cycle of an organization, and we told them to remember the need you are filling and the people you are serving. Continue to press forever forward, and they did. With the support of our expert facilitators, leadership, and organizational coaches, they got back in there, they put in the work, and I am proud to say that they met every goal that they set out 3 years ago to achieve. You can give that a round of applause. That's awesome. So when I think of the Trenton Kids Count 2023 data booklet, those words ring in my heart, forever forward. As we launched the planning for this book, we already had an idea that because of the pandemic, our numbers would not look great. But we also knew that Trenton is more than numbers and data points. We knew that the city was filled with people like Mayor Gusiera and his department heads, Senator Shirley Turner and Vonzelis Crown, and so many others who knocked on the doors of our city's elders during the lockdown to make sure that they had masks and other essential items, letting them know that they were not alone, moving our city forever forward. The data shows that the unemployment rate was a high 10.6 in 2020 and an 8.1 in 2021. People were out of work, but organizations like the YMCA, Help Self, Mercer Street Friends, and local business like Trenton's Meat Farm, 1911 Smokehouse Barbecue, and other local grocery stores, and so many more made sure that our children and families did not go hungry, moving our city forever forward. We witnessed the disparities in health care for urban centers, but Henry J. Austin, the Trenton Health Team, Children's Futures, and other health-focused organizations were out there daily educating the community about how to stay safe, providing access to vaccinations, and reminding us that we needed to continue seeing our doctors for our regular health care needs, even if we were afraid. They were continually moving our city forever forward. The stats show that graduation rates from Trenton Public Schools decreased by 11%. And we all band together to make sure that those graduating seniors and those who matriculated into institutions of higher education and or technical school receive college care packages. One Stop in Mill Hill helped employ some of the city's youth, and too many organizations to name provided programming and support for our children, moving our city forever forward. And the philanthropic community shifted in ways that were unprecedented. We decided, to allow organizations to update their funding so that they could meet immediate needs. We were getting money out in a nimble and more equitable way, and meeting nonprofits on the ground. And for that, I would like to extend my sincere thank yous to the founders and the board of directors of the Smith Family Foundation, the Burke Foundation, and the Princeton Area Foundation for supporting this initiative. I'd like to thank the committee who planned the publication and the release of the community conversations. Thank you to Mary and Alina. From Advocates for Children of New Jersey. Thank you, Mayor Gutierrez, and the wonderful and insightful panel. Thank you, Eleanor, Rachel, Denise, thank you, because we pour her out the audience. And Assemblywoman Verlena Reynolds-Jackson. To further unpack the data in the Kids Count report, we will engage in community conversations, which you heard us talk about. Over the next 4 months, you don't want to miss these lively discussions. If interested, we are still looking for places to host them, so please talk to one of us, Mary, myself. So on February 15th, we're going to be diving into the education and development portion. On March 15th, we'll dive into health and human services. April 19th, we'll dive into juvenile justice and crime. And on May 17th, we'll dive into housing and economics. So all of you who had all of those questions, come, because these questions will turn into actionable points at the community conversations. And while analyzing this data, we are not looking at defeat and hopelessness. We are looking at resilience, and we are looking at fortitude. We are diving into hard realities that must be grappled with. And together with the citizens leading the charge, the philanthropic community, the nonprofits, elected officials, corporations, educational and religious institutions, small businesses and art programs will put in the hard work to come up with solutions and advocate for policies to move our city forever forward. Thank you all for coming out today. Thank you all for coming out today. My name is Catherine Nunnally. I am the CEO of the Smith Family Foundation. Our mission is to empower our community, cultivate leaders, and transform lives by providing funding and leadership development to organizations serving Trenton, New Jersey. Today and every day, I am so proud to say, this is my Trenton. This is our Trenton. And together, we will win. Thank you.